Okay, let's play a little guessing game. What's the one perimenopause symptom that leads people to the ER? They go to the ER, they're told everything is normal. It must be stress. It must be that you're drinking too much coffee. It must be that you got too much going on in your life. And you leave the ER frustrated, upset, don't know what's going on when you felt like something was legitimately wrong. So this is the number one perimenopause symptom that gets missed a lot by doctors. In fact, even Oprah's doctors missed it for 2 years. Let's watch this clip.
The queen of daytime TV says her menopause symptoms were missed by doctors.
For 2 years straight, y'all, I did not sleep. I picked up a book and the pages opened to Palpitations, Your Heart's Wake-Up Call. And that was the first time that I learned that those were symptoms that the change was coming. One time, my heart rate was 212 beats per minute because I was in an AFib heart palpitation situation. And nobody ever once said, this is a symptom of menopause. I really thought I was going to die and was always surprised that I woke up. The worst part for me, I could no longer finish a book. And that is the real reason why, because I could no longer concentrate enough to finish a book.
Yep, you guessed it, heart palpitations. Heart palpitations are a very, very common symptom of perimenopause. A lot of doctors are told by women, yeah, I feel like this sensation like in my chest, like fluttering, like I had too much coffee. I was just sitting around doing nothing. Or I was in the middle of sleeping and it woke me up. That is a very common perimenopause symptom. And it's often missed by doctors because they don't recognize the fact that hormones change in midlife, and this affects the heart. So let's break it down so you understand exactly what happens. In midlife and perimenopause, the decline of both estrogen and progesterone, and that happens in a roller coaster fashion. It's up and down. So 1 minute you feel this high and you feel great, like when you were pregnant and your mood is awesome, and another minute your estrogen is incredibly low. The heart relies on both estrogen and progesterone. Estrogen helps make not just your heart, but your blood vessels pliable and flexible and able to regulate themselves. So the autonomic nervous system is something that regulates your heart rate, your breathing, the tone of your blood vessels, in other words, your blood pressure. And so when you lose estrogen, you lose this wonderful hormone that helps you relax those blood vessels, but also helps you regulate those. So it controls not only your heart rate, but your blood pressure and the beating of your heart. Progesterone is a relaxing hormone. It works at the GABA receptors to calm estrogen stimulation down. So estrogen makes you feel like your vessels are pliable and your heart's working great and strong, and progesterone relaxes out. And they have to be working complementary to each other. So when you start losing estrogen and progesterone, what even makes it worse is things like stress, dehydration, lack of sleep, all throws these normal systems even further off. And so when you hit midlife and you start experiencing heart palpitations, then they feel like even a panic attack, chest pain, pressure, heart racing, sometimes leading to anxiety because it's very uncomfortable feeling. And you go to your doctor and they do an EKG. They do maybe even a stress test, maybe even an echo, depending on how much of a cardiac workup you have. I mean, just like Oprah, she had a full $1 million workup and saw a cardiologist for 2 straight years, and no one said anything about hormones. And when you get these done, you're told they're normal because they are. Structurally, your heart is normal. There's nothing structurally wrong. This is the function or the rhythm of the heart. So you could potentially pick it up like if you were doing a Holter monitor for 24 hours, but most tests that are done in a cardiologist's office are just that moment of time. So why does this matter? It matters because your heart is an organ. It's a target organ. So understanding that these symptoms are happening helps you recognize that you're experiencing perimenopause or early hormonal changes. And not only your heart gets affected, your brain, your bones, your muscle. So use this as a sign that you're starting to actually have these hormonal changes. So what can you do? One, you can actually track your symptoms. When do these occur? Are you in motion? Are you doing activity, exercise? Is it when you're stressed out? Is it waking you up at night because it's combined with hot flashes? Track those symptoms to go to a doctor who specializes in menopause care, and she understands, or he understands, that these are hormonal changes. And then 3, there are things you can do. Hormone replacement therapy is definitely an option for replacing what is actually missing or going down. But also there are things that can be done, not only hormonal, but to look at your heart health. And I'm a big fan of actually having a more preventative medicine strategy to understand how healthy is my heart and what is it that I can do in the future to make sure that I'm staying on top of that. Because remember, the number one killer of women is actually heart disease, not breast cancer. So if Oprah's doctor commits it, so can anyone. So please like and subscribe if you liked this video. Make sure that you check out my free Are You in Perimenopause quiz. The link is in the bottom in the comments. And there I can help you kind of navigate these perimenopause symptoms to see if you're also experiencing other things associated with perimenopause. I'm Dr. Jen, and just remember that midlife is not a time of decline. It's actually a pivot moment to start looking at your health differently and how you can age the way that you want to.